Welcome to Eshe Talks. Through this platform, we are here to learn, share, and also, take a real steps towards our own well-being. And you know what? Today's topic is beyond period pain. Could it be fibroids? Could it? I also don't know. Maybe at the end of this session, I know we will know what it is. And I know most of us have been asking, like, you've been having these questions, but tonight, all the questions, or everything will be cleared out with this topic. It's going actually to be amazing. So as we begin, feel free to introduce yourself in the chat and tell us where you're joining us from. And today's expert is none other than Dr. Maina. And before I introduce him, just to let you know that he will be doing his presentation for about 30 minutes. After his presentation, we will have a session for Q&A. When that time comes, please feel free to ask any question. Don't feel, when that session comes, please feel free to ask any form of questions that you have prepared about this topic. Don't feel shy, because that's the floor will be open for you at that time. Yeah. So let me introduce the speaker. Today's speaker is none other than Dr. Maina Ngoigo. He is an obstetrician, gynecologist, and he is a HIFU specialist. As you can see there on the screen, he is saying, "I'm here to help, to listen, and to educate." No shame or judgment here. He is not here to come and judge. So it's the one thing we love about him is he has helped many women. He has helped them to have knowledge about fibroids and to help them they have taken charge of their health because he has been of help. And tonight we are not going to only hear about his knowledge, because we know he is very supportive, and he is going to educate us on what is fibroids, how it comes to our bodies, and how we can avoid them or how we can treat them. And so without further ado, Dr. Maina, the floor is all yours. You're welcome.
Good evening. I think it's actually evening. That's about 8 p.m. Good evening to all our viewers. And thank you, Miriam and Eshe at large, for this opportunity. My name is Dr. Maina Ngoigo. I'm an obstetrician and gynecologist, and also a HIFU specialist. I think I'm going to explain to you what HIFU means as we go along the way. I'm very happy to be talking to you this evening about a topic that bothers majority of our sisters, our colleagues, our mothers, and our friends, and of course our wives. And I couldn't be more proud to speak about the issue of period pain with a particular focus on fibroids, because this is a disease that afflicts and affects majority of women in the society, and yet sometimes it's quite asymptomatic. So the diagnosis sometimes is very incidental. But as you're going to see, period pain, fibroids, these can, they are quite debilitating, and sometimes can affect the quality of life of women. So I would want to begin my presentation. And in case you're not able to hear me, you can shoot straight and let me know. In case the slides are not moving, you can as well let me know, and then we can type our questions in the chat box, and Miriam is going to help us to address them at the end. And I think I'm good to begin. So when you talk about period pain, sometimes as a human being, what I usually wonder as a doctor, and also as even as a man, what's the severity of this pain? How do women feel when they say they have severe period pain? How debilitating is it? We know sometimes painful periods prevent our women from attending to their work engagements, sometimes debilitating enough to prevent them from being fully productive, and sometimes even prevents especially younger girls from fully attending to their school commitments. And that therefore means that we must not normalize period pain, and therefore everyone should seek for help and for care when they have extreme period pain. So the gist of this presentation, basically, we are going to look at some of the important things that are important for us to understand. We will briefly look at what are these things that usually, would cause severe period pain, because we know that once we identify the root cause of any problem, we can be able to tailor targeted treatment or management options. Then we look at the general management approaches of this period pain. Then we dive deeper onto the issue of fibroids, because with the current change in lifestyle and diet, our genetic makeup, our lifestyle where maybe we're not exercising a lot, there's tendency of increase in obesity, which is associated with fibroid development. So we're going to look at some of the risk factors, what symptoms can warn you or maybe alert you that maybe you could be having fibroids, some of the tests, and of course look at which are the ways of managing fibroids. But I will spend a lot more time on discussing a new technology called HIFU, which is basically an non-invasive approach to management of fibroids, which is to mean that traditionally we've been managing fibroids using surgical approaches, basically by operating. But in recent times, we are able to treat fibroids without really cutting anywhere, without any blood loss. And this is becoming an important arsenal in terms of broadening the options for women to treat the fibroids. So of importance is to define what is dysmenorrhea, basically painful periods. So this is painful periods with lower abdominal cramping, and sometimes it can be quite severe, sometimes it can be mild. A majority of times, some women will present with a severe period pain, which is also associated with a feeling of nausea, sometimes vomiting, and sometimes just extreme fatigue. It's also important to discuss what is called dyspareunia, which is basically pain during sexual intercourse, and this should not be normalized as well. So feeling pain during sex should not be a normal thing. And then the other term I would want us to put at the back of our minds is abnormal uterine bleeding. Basically, menstrual bleeding that is not in keeping with what is expected. So we know that normal periods ordinarily would last between 3 to 8 days. Probably the amount of flow should be around approximately about 80 mils in the entire period. And generally, periods should be regular. So we are looking at periods that are higher in terms of amount of blood loss, periods that exceed 8 days or basically more than a week, and periods that are also irregular. What could be the causes of these things? So the common causes of severe period pain, which is our focus today, are the above, which I have listed there, but they're not limited to only this, only that these are the commonest. And top among them is endometriosis. And endometriosis, just to mention, is an increase. There is increased awareness around the issues around endometriosis and adenomyosis, because it's been found to be very common. And one of the challenges has been underdiagnosis of endometriosis and adenomyosis. Now, endometriosis, as you can see from the screen, basically it's growth of tissues or basically cells that otherwise should be within the uterus cavity, growing anywhere else apart from inside the cavity. So if you have uterine kind of tissue growing outside the uterus, or tissue that resembles that tissue that you'd expect in the uterus, but now it's growing outside, like you can see on these black areas. For example, it's growing around the ovaries here, around the tubes, sometimes around the intestines. That is called endometriosis. Remember, these tissues, they resemble the tissues in the uterus, and therefore they are responsive to hormones, the estrogen, the progesterone, and therefore every time during periods when your hormones are alternating or fluctuating, these tend to be active tissues, and therefore you can have some minimal bleeding and of course some pain. That is the same case with adenomyosis, but now the difference between endometriosis and adenomyosis is the fact that you still have these tissues that resemble what should be inside the innermost covering of the uterus, but now these tissues are deposited within the muscle of the uterus, as you can see here. So where these deposits are is on the muscle of the uterus, basically what contracts during delivery, for example. And because these are also responsive to estrogen, they also become active during the menstrual fluctuations. Of course, our topic of interest today is fibroids, and you can see these yellowish masses here. In simple terms, fibroids usually would resemble potatoes, and you see they grow either inside the cavity, within the muscle of the uterus. They can also grow outside the uterus, and even around the uterus. And it's incumbent for me to mention that endometriosis, one of the commonest signs of endometriosis is severe period pain. And majority of the times, more than 90% of patients who present with severe or excruciating period pain, when investigated, they are found to have, endometriosis. So if you have excruciating severe period pain, it's probably time to get evaluated for endometriosis. Uterine fibroids, majority of the times, about 30 to 40% of the times, they are asymptomatic, which means that they are diagnosed incidentally during routine evaluation. But for those patients who are symptomatic, the two main common things that clients would present with include severe, excessive blood loss, what we call abnormal uterine bleeding, which I had just described, and secondly, dysmenorrhea, which we have already described as severe period pain. And this occurs amongst a population of about 30 to 40% of women who have fibroids. Then you have pelvic inflammatory disease. So this one, this is basically infection of the internal genital tract. This could be the cervix, the inside of the uterus, the fallopian tubes, and also the area surrounding the ovaries. Majority of the times, the infections that cause this infection, called PID or pelvic inflammatory disease, are actually sexually transmitted diseases like gonorrhea and commonly what is called chlamydia. And these, of course, are associated with increased period pain. What are the general then approaches to management of period pain? So we have basically exercises, we have pain medication like brufen, mefenamic acid. These are things which are available over the counter. You have heat therapy. We know that heat therapy and exercise increases the blood flow towards the pelvic organs. And how this helps is that when heat therapy causes, basically enlarging or basically dilatation or enlarging of the blood vessels that bring blood towards the pelvis. And because we know that part of the reason why people feel pain during menses is because of hormones that cause some form of reduced blood flow to the uterus because of contractions. Once we bring on heat therapy or those warm compresses, there's increased blood flow towards that area. Increased blood flow ensures that we don't have what is called ischemic pain or pain due to limited blood flow. Then, of course, there's the issue of stress management, reducing the stress hormones. Adequate hydration helps with increased blood flow again, and also elimination of those products of inflammatory products. Then you also have herbal remedies. And these are general management approaches, but there are now specific approaches to treatment depending on what exactly is causing the severe dysmenorrhea or the period pain. And we have already seen that these are the main causes. So depending on which cause is identified, then specific treatment can be tailored for either endometriosis, adenomyosis, fibroids, and even pelvic inflammatory disease. So as I have mentioned, the specific approaches, so these are general approaches, then these are the specific approaches. They are dependent on the cause, and they can be either hormonal or they can be surgical therapies. And even currently now we have non-surgical techniques to treat some of these conditions. So now really sorry for that. So I was saying after that introductory bit, I'm going to focus on fibroids. And I was saying the reason why fibroids are important to discuss is because they have a huge impact on the quality of life of women. And they are just basically non-cancerous tumors, among women of reproductive age. And basically, fibroids are more common among women of the Black race as opposed to other women. Majority of the fibroids, of women with fibroids are actually asymptomatic. That 30 to 40% of them are asymptomatic, and therefore they are just diagnosed incidentally. I was talking about the age distribution here, and I hope you're still with me. And you can see they are basically found amongst women of reproductive age. As you can see, about 25% of all women with fibroids fall in that age bracket of about 40 to 44. 27% again, these women who fall between that age of 35 to 39. So basically, you can see these are young women who are within the reproductive age brackets. They're the ones who usually are affected and afflicted by fibroids. So on this slide, what I had been trying to discuss very, without going to many details, is basically what risk factors increased risk of developing fibroids. And the main factors actually are, I could say age and reproductive history. For example, women who start having their periods earlier than 10 years, and those women who have their menopause later than 50 years, have a prolonged period of exposure to estrogen, and therefore these women are at risk of increased risk of getting uterine fibroids, because fibroids usually are driven. The growth of fibroids is driven by estrogen. Now, race and genetic makeup also is a huge factor in terms of determining who is not likely to develop fibroids. And this is because it has been shown generally that women of African descent have a higher likelihood of developing, uterine fibroids. Now, women who are, obese, those who, take alcohol, and especially those who do not do they don't exercise frequently, they are at an increased risk of, developing uterine fibroids, as opposed to their counterparts who have low BMI. So, for all of us, it's basically important to keep checking our BMIs to determine that we are not in the obesity range, because we have already seen that this is one of the risk factors. You can see I put an asterisk there on smoking. It's been shown that there's a slight decrease in the risk of developing fibroids for women who smoke. But of course, this is not to encourage anyone to smoke, because we know it is associated with other, undesirable effects on our bodies. So what symptoms then do fibroids present with? So the commonest of all of them is heavy menstrual bleeding or abdominal uterine bleeding, which we had already seen. And this is found amongst about 30 to 40% of women. Of course, frequent urination is another factor, or basically increased frequency of passing urine. And this is because when fibroids are very big, they tend to put some pressure on the bladder. The uterus and the bladder are usually in close relation. So when you have very big fibroids, sometimes they can cause pressure on the, on the bladder, and you feel like passing urine frequently. And of course, the other thing apart from frequency is feeling hesitancy to pass the urine. Increased pain during sexual intercourse. Pain during sex should never be normalized. So if you're having severe pain during sex, probably it's about time to get checked for either fibroids, endometriosis, or even adenomyosis. You can also have increased lower abdominal pain and lower back pain. Sometimes constipation, especially if the fibroids are very big and causing compression on the rectum. So I was talking about the impact of fibroids on reproductive health for women, and it affects, their quality of life, because sometimes they're not able to attend to their work, they're not able to attend maybe to their academics, or basically sometimes if they're having very heavy bleeding, they're not able to attend to their places of their social places. Majority of women also present with anemia, low blood levels, because they have been bleeding consistently month in, month out, and sometimes they have to be on supplementation. Then we have the issue about recurrent pregnancy losses, or basically frequent miscarriages. Of course, it carries with it psychological impact and affects self-esteem, because sometimes you find fibroids which are very big, and I've come across women who tell me that, Daktari, my friends think that I'm expectant because the fibroids are so big, they're so huge, they're almost the size, the uterus becomes the size of maybe a 7-month-old pregnancy. Of course, it has financial implications, because we know when you have fibroids, some of the things that happen is that sometimes you're not able to, attend to your work, and therefore there are missed work days. Missed work days equals missed or rather reduced income. Of course, the cost of investigations, for example, doing MRI, doing the ultrasounds, not to mention the cost of treating. So basically the monthly supplementations with the blood boosters, sometimes the surgery that is required, and even in recent times, other approaches that we are going to see. So some of the tests that we do to determine whether, a client has fibroids include, ultrasound, which can be done through the abdominal route or even through the transvaginal route. The MRI, a pelvic MRI, usually has a higher resolution and can be able to visualize the fibroids a little bit better than the ultrasound. It can be able to tell us about the number of fibroids you could be having, the size of these fibroids, how much blood flow is going to these fibroids. And of course, there are also these other techniques I've listed below. So then how do we manage uterine fibroids? Why do we want to manage them in the first place? We have already seen that fibroids they are sometimes can be debilitating to women by affecting their quality of life, by reducing their amount of hemoglobin and causing them to have anemia. by even causing them to have, they affect their sexual life, because sometimes some women have very excruciating pain during intercourse. And of course, we want to reduce, or basically to alleviate some of these symptoms, we want to reduce the associated blood loss so that you don't consistently have to be on blood boosters every month, because that is an economic cost. We also want to control the pain that is associated with your periods, because remember we had mentioned that one of the symptoms of fibroids include a pain. Apart from just heavy bleeding, pain is another important symptom. So we want to manage and control the pain. Generally, we also want to improve the overall quality of life of our women. That is the reason why we want to manage and treat fibroids. So what are these approaches to managing fibroids? So commonly, and in most of our hospitals and clinics, to reduce blood flow, we use some of these medications which are listed here, and I think maybe some of us might have come across them: tranexamic acid, mefenamic acid, brufen. These medications can be used to reduce blood flow, and it has been shown that when you use this medication either singly or in combination, there is associated 30 to 40% reduction in the blood loss. And this is significant, especially for women who have developed anemia from abnormal uterine bleeding, which happens every other cycle. Of course, there are hormonal methods, and these hormonal methods can be the combined hormonal pills. Basically, these are meant to reduce the amount of blood flow. However, it is important to mention that the combined pills are not really to shrink or treat the fibroids, but to reduce the amount of blood flow. You can use, the implant. You can use, the coil, the hormonal coil, to also reduce the amount of blood flow that is associated with fibroids. And of course, there are other methods where you can inject, hormones called GnRH. These are hormones that we inject maybe every month or every 3 months to be able to reduce the amount of estrogen in the body, and therefore when the estrogen you can use, the implant, you can use, the coil, the hormonal coil, to also reduce the amount of blood flow that is associated with fibroids. And of course, there are other methods where you can inject, hormones called, GnRH. These are hormones that we inject maybe every month or every 3 months to be able to reduce the amount of estrogen in the body, and therefore when the estrogen is low or it's blocked, then we deny the fibroids from growing from the drive by this estrogen. But of course, remember, the moment you deny the body estrogen, there are the benefits of shrinking the fibroid, but on the flip side, sometimes you can have menopausal symptoms which are undesirable. How about surgical approaches? So not every candidate is a candidate for medical management, or basically the hormonal therapies we have said. And even so, some women, after being treated with hormonal methods, still do not have proper control of the symptoms that they presented with. And some of them end up needing to be done surgery. So the types of surgery that we do, are called either myomectomy or basically hysterectomy. So myomectomy is basically to remove fibroids, and this can be done through a big incision on the tummy or small keyhole incisions, what is called laparoscopy, or sometimes through the vaginal route, what is called hysteroscopy, by shaving off the fibroids which are within the cavity. Now, for women who have completed maybe their desired family size and they have symptomatic uterine fibroids, some of them may opt to have their uterus removed altogether, and this is called hysterectomy. Now, this hysterectomy or removal of the uterus can be through a major incision or a major cut on the tummy. This is called laparotomy, or the uterus can also be removed vaginally or even through laparoscopy. And this is important to keep at the back of our mind, that there are several different options to treat fibroids surgically, either through open surgery, laparoscopy, which is minimally invasive or basically keyhole surgery, and even removal of the uterus in total. In recent years, we have also undergone a lot of technological development and advancement of medicine. So we now have what is called uterine artery embolization. This is a minimally invasive approach to management of fibroids. Remember this word, it is still invasive, meaning that you're still breaching, the skin to be able to, institute mechanism to treat these fibroids. However, you're not making any big cuts on any part of the body. So basically, you are blocking the blood vessels that take the blood to the uterus, because remember, blood circulation or blood flow to the uterus and to the fibroids is what stimulates their growth. So once you limit the blood flow going to the fibroids, then gradually they shrink and symptoms continue to resolve. So that is called uterine artery embolization, and it is also being done locally. And this is basically a setup of how this procedure is done. Maybe you'll see it better in this subsequent slide. So some agent is injected into a vein within the thigh, and it comes and blocks some blood vessels where the uterus is. And you can see that once this is blocked, it means that now blood is not able to go to the fibroid or the capsule of the fibroid, the lining around the fibroid, and therefore gradually this fibroid is deprived or denied blood flow and gradually shrinks, and the body is able to resorb it. That is called embolization, basically blocking the blood vessels going to the fibroids, basically going to the uterus. Now, you can see that we've come from, conducting surgeries that cause great trauma to the body, big cuts, on the abdomen, take a lot of time to heal, a lot of, prolonged hospital stay. We have gone all the way to minimally invasive, basically what I was describing here, the embolization. And even now, we have an even newer approach to management of uterine fibroids called HIFU. Now, HIFU means high intensity focused ultrasound, HIFU. Now, HIFU is purely non-invasive. Take note of that. They are purely non-invasive. The best that we ever came before HIFU was minimally invasive. Before minimally invasive, we had invasive techniques, the surgical approaches, the open surgery where you make a big cut on the tummy. So the current technology we are using, and we are very lucky in Kenya, we have a center that offers HIFU for treatment of women who have fibroids, is the newest dispensation in the treatment of fibroids. And let's dive and see, what is this HIFU thing? So before we see how the HIFU works, remember, women may present with many problems. Now, HIFU can be used to treat fibroids, adenomyosis that I had described as one of the causes of heavy bleeding and a lot of period pain, and other problems listed below. But for the purposes of this discussion, we'll focus on how it manages fibroids and to a smaller extent, adenomyosis. So many women all over the world have been treated for fibroids and adenomyosis using HIFU. Actually, we are approaching now, I think this data is, I think, up to around 2024. We had about 320,000 women who have undergone this procedure called HIFU to treat fibroids and adenomyosis using a totally non-invasive technique. Now, this technique, as I said, it's a new technique. It's only new here in Kenya. In the other parts of the world that are technologically advanced and they invest more in medicine, this technology has existed for about 30 years, basically 3 decades. For us here in Kenya, we are very lucky. We have gotten a center or a machine that conducts this treatment at least beginning this year, and I'm going to tell you where this setup is. In Africa, these machines, we only have, I think, about 7 machines only. Our regional neighbors, only Tanzania has 1 machine, and now Kenya, we have 1 machine. We are going to see what HIFU is all about. So I say that HIFU is high-intensity focused ultrasound, and that is to mean we use ultrasound energy to treat fibroids by basically killing off the fibroid. So we target these fibroids with energy generated from the ultrasound transducer. We kill the fibroid and destroy the blood supply around it, and the fibroid has no choice but to die. naturally, gradually shrinks. With shrinkage of the fibroid, there is resolution of the symptoms. So how does this concept work? You remember maybe when you were young, and maybe some of us who are pursuing sciences are still looking at this concept of using a magnifier. I think this was actually in primary schools where we could use a small lens to focus sun rays to choma, or basically to burn a paper. And I'm sure maybe some of us did this experiment. You focus some sun rays on a focal point, and this convergence of sun rays causes energy that can burn the paper. This is the same concept that HIFU applies. There is a transducer that emits ultrasound waves, focuses this wave on a particular point, like we saw with the lens. Now, this point hits to about 65 to 100 degrees Celsius. And now this point is targeted on the fibroid, like you can see here. This particular point is within the fibroid and causes death or destruction of the fibroid and destruction of the blood supply of the fibroid. And gradually this fibroid shrinks. Within about 6 months, more than 60 to 70% of this fibroid would have shrunk. By about 12 months of having done this procedure, 70% of the volume, the initial volume of the fibroid before treatment would have shrunk, and the symptoms also tend to resolve. So this is basically how it works. Here we were using ox liver to demonstrate, basically liver of of an ox. So this is a transducer, emits ultrasound waves. Now these waves are targeted on a particular place on this liver and causes this damage, thermal damage. Now this part is not alive. So this technology ablates, or basically kills off or burns several spots on the fibroid. So this tissue here, the liver, represents the fibroid. So we burn or basically ablate different points on the fibroid and cause irreversible death or irreversible damage to the fibroid. And now this fibroid, once it has been killed, it shrinks gradually. Of course, there are some important preparations to do this procedure. Some of them include coming to see us at the clinic. We determine whether you are a good candidate for HIFU, or these other techniques I described would fit you better, because treatment is very individualized. Every client would fit a different criteria for treatment. But in a nutshell, we do something called simulation, basically to localize where these fibroids are located within the uterus, to determine how many fibroids are actually on the uterus, what's the size of these fibroids, how treatable are these fibroids using this technology called HIFU. Then, of course, before treatment, we request you to do a pelvic MRI to be able to characterize these fibroids even better. We can be able to tell, are these fibroids very vascular, or are they of low vascularity? And of course, the rest of the preparation includes the intestines and the bladder. So this is how the machine, the HIFU machine, looks like. So this is the bed. Now this blue lining is where we have the transducer and a probe inside. Whatever happens here is controlled by this panel. And this panel, of course, is controlled by these keyboards here. So movement of this bed back and forth, up and down, the transducer which is inside, it moves right, left, up, down, this direction, to be able to target where the fibroid is and to be very precise to ensure that this ablative point that has heated to about 65 degrees is only within the fibroid and not anywhere else within any other tissue, basically for safety purposes and for precision. So as the client who has fibroids and is for treatment lies on this bed. So the team of doctors usually sits on this panel to control, and of course you can see it's quite tech savvy, to control whatever is happening to this treatment panel. The treatment takes about 1.5 to about 2.5 hours, and after 2 hours you go and rest on a waiting area just within the clinic. And after that, you can be able to actually, go home. So we're going to see some of the advantages of actually conducting HIFU instead of the conventional surgical techniques for fibroids. So this is basically the client's positioning. So you are lying on your tummy. You can see this red thing here is the fibroid. This here, the mustard, is it mustard or is it yellow? Sorry, I could be colorblind, but this is the transducer, the mustard equipment. It focuses ultrasound waves, like the lens focuses sun rays, to a particular point within the uterus basically where you have the fibroids. Now, that particular point is very hot and is the point that ablates or kills off the fibroid. Any area surrounding the uterus does not receive this kind of heat, and that therefore means that the rest of the organs remain safe. So this is basically the treatment panel. So once you treat, this is, for example, a fibroid, we target it with some energy, we ablate, or basically we burn, and then we start having these gray changes on the fibroid until the entire fibroid has these extensive grayscale changes. Now, a fibroid with extensive grayscale changes is considered to be fully treated. And after treatment, we usually conduct a check to see whether we manage to kill off the fibroid. So you can see that, this fibroid is entirely dark or black, which means that this fibroid is not alive. It has been killed. So before you even leave the operation table or the table that I just showed you, as doctors, we are comfortable and confident that the entire fibroid has been ablated or has been destroyed. Why HIFU? Why not other approaches to treatment? We have already seen that it is non-invasive, so there is no surgery. It is convenient because it is a day procedure. You come, you get treated, you go home, you go back to your work. There is no blood loss involved because there is no cutting. There is precision in treatment because we have seen that it is real-time ultrasound-based treatment of fibroids. It's a day procedure, so you return quickly to your daily activities, and then there's gradual shrinkage of the fibroids and the symptoms resolve. And of course, as I had mentioned, that more than 70% of the fibroids would have shrunk within 12 months. More than 60% of the size of the fibroids will have shrunk within 6 months. And this is commensurate to the resolution of the symptoms. This is an image of basically demonstrating, previous work that we have done of treating fibroids. So you can see this uterus has even shrunk even more because of ablation, or basically this HIFU energy. And this is an MRI follow-up. Apart from the imaging showing the fibroids, even the quality of life of women who have undergone HIFU, you can see, improves significantly. So there's usually a tool to assess and score the quality of life based on particular parameters. So after HIFU treatment, you can see the quality of life of women improves. Of course, we would ask about recurrence. For women who undergo surgery for fibroids, the conventional surgery, 10 to 30% will have recurrence within a period of 5 years. For HIFU, because we are also destroying the blood vessels and also destroying the blood vessels surrounding the fibroid and the fibroid itself, we have a recurrence rate of about 15%. So of course, you can see it compares with conventional myomectomy or even better. After this HIFU procedure, women can conceive normally, and they can also have normal delivery. And this is basically data to show you that in a particular multi-center studies conducted elsewhere, there was a more than 47% conception rate amongst about 174 patients who underwent HIFU. And of course, this is very encouraging because some of the women who come to see us come to see us because of recurrent pregnancy losses, that is miscarriages, others because of inability to conceive, and some of them are unable to conceive maybe because of symptomatic fibroids. So, in a nutshell, what are we saying? Number one, we had already mentioned that period pain should never be normalized. If you have period pain, think, what could it be? Could it be fibroids? Could it be endometriosis? Could it be adenomyosis or other causes? Go for evaluation. If it is fibroids, discuss with your doctor what are the treatment options. If you are given this choice to do open surgery or minimally invasive surgery or totally non-invasive surgery, what informs the choice that you can make in terms of the treatment that you want? Where we work, we conduct HIFU, non-invasive treatment of fibroids. We do follow-up of our clients, both in terms of symptom control as well as shrinkage of the fibroids over time. And the whole reason why we had this discussion is basically to empower our women to be able to, have free choices of their own reproductive health goals, and not to be tied to particular dogmas, but to be able to own their own reproductive health journey. And therefore, periods should not really be punishment for not being pregnant. And the reason I put this slide here is because there before you could hear people being told that you are getting fibroids because maybe you didn't get pregnant. You're getting these period pains because you didn't get pregnant. And at the end of the day, we know that majority of these conditions are related to hormones. That is including the endometriosis, the fibroid that we talked about, and they can be managed. So where can you find us? Landmark Plaza, opposite Nairobi Hospital, first floor. That's where you can find the HIFU Center. And for more information, of course, because I would want to think that we have a lot of questions around this issue, around the new technology, around maybe cost, around who can be done HIFU. This is your contact, and you can copy it. And that is our email. And I think that is the end. I thank you for listening to me, and I would want to pick a few questions. I hope I have been talking to somebody. I hope I was not talking to myself this time around. Over to you, Miriam.